Borderline personality disorder, or BPD, is a serious mental disorder which consists of dysfunction in personality functionality, pathological personality traits, and impulsivity. The symptoms of BPD were first described as the borderline group by Adolf Stern in 1938. Patients were considered borderline if they had symptoms of neurosis and psychosis. Borderline psychosis that lie on the fringes of schizophrenia was a prevailing factor in preventing these patients from receiving treatment or therapy. In 1980, it officially entered DSM-3, known as borderline personality disorder. The name borderline personality disorder remains. However, in Europe, it is also known as emotionally unstable personality disorder, or EUPD. The DSM-5 criteria for borderline personality disorder requires that the symptoms be present in chronic terms and across situational events. The criteria consist of dysfunction in personality functioning, pathological personality traits, and impulsivity. The stress and impairments of personality must be chronic and not due to the physiological effects of situations, substances, or medical conditions. At least 5 of the DSM symptoms must be present long term. The symptoms can manifest in the borderline individual with intense fear of abandonment, out-of-context anger, risky sexual behavior, cutting, or suicide attempt. The impairments and instability that develop in the sufferer's personality traits leads to the splitting of thoughts. Everything is perceived as black or white. There are no gray areas of emotion. Modest estimations suggest 2 to 4% of the population is affected with BPD. The increased number of studies have not shown a correlation between age, race, or education. Although women have been diagnosed with BPD more often than men, the prevalence rates are equal in both sexes. Studies which suggested that 4 to 9% of those with borderline criteria commit suicide. As many as 80% of people with BPD exhibit suicidal tendencies. Recent studies show that biological factors may play a significant part in the predisposition of the borderline disorder. Dialectical behavior therapy, or DBT, is a cognitive behavioral treatment. A combination of cognitive and behavioral skills are used in treatment sessions. A unique aspect of DBT are the 4 stages of treatment that a client works through until successful. Cognitive behavioral therapies, or CBT, are directed with the intent to change debilitating thinking patterns and schemas. Distorted thinking patterns and negative schemas contribute to BPD's patient's inability to process thoughts and feelings rationally. CBT treatment results in positive behavior changes by targeting the negative thoughts and feelings. Mentalization-based therapy, or MBT, uses mentalization to focus on stabilizing the sense of who the patient is and assisting in developing healthy, balanced relational ties. Although the inability to discern or make appropriate mental processes is a factor in many mental illnesses, this cognitive issue is a prevailing symptom of BPD. There are also books for the individual with BPD or for family and friends of BPD sufferers. This is not the end. Conversations on borderline personality disorder is a collection of stories and experiences from all ages and stages of BPD. I Hate You, Don't Leave Me includes up-to-date research that has opened the doors to the neurobiological, genetic, and developmental roots of this disorder. There is always hope. Hope for the moment, for the day, and for a better tomorrow. Reach out in the darkness. There is someone who wants to hear your story. Seek help from a professional. You are not alone. Know your worth. You are worthy because of who you are. As Martin Luther King Jr. once said, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. If you need help or just someone to listen, please call the National Suicide Prevention Lifeline. It is free and confidential.